Hello, this is the training fitting for the low-tech AAC device for Ismael, Santiago, Gabriel, for the parents, the staff, and therapists. This presentation has been revised by Dr. Padin, and it was put together by Milvia Garcia and Zina Moreira. This slide introduces the long-term goals of this treatment, which include the consistent use of the Big Mac low-tech device to allow the patient to communicate yes/no responses in all environments according to physical and cognitive potential. In addition, the patient, parents, caregivers will be familiarized with the Big Mac AAC low-tech device for continued daily use with 100% accuracy. We have broken this down into short-term goals, which we will be targeting throughout the weekly therapy sessions to work towards the long-term goals. Some of these include the accurate use of the Big Mac device for activities of daily living according to needs and potential spontaneously. And it is important that parents, caregivers are familiar with using and programming the device. This is the Big Mac. It is a simple device that speaks a message, and you can program any message you want. It comes in a range of colors which are interchangeable and can easily be screwed on and off the top of the device. It also comes in different sizes to facilitate with dexterity. The Big Mac typically requires one alkaline 9-volt battery, which can be easily added on the back part of it. Once this is completed, you can turn it on. We have an upcoming slide which will show a video demonstrating how to record messages. The Big Mac allows for a total of 2 minutes record time. It's important for the buttons to be different colors in order to help the child differentiate between them. And as I mentioned before, we can add words and/or pictures to the top of the device, which can be easily replaced. We will now briefly discuss some of the activities we'll be implementing while targeting the desired goals. Goal number 1. The patient will respond consistently and accurately, utilizing the Big Mac low-tech device, answering to yes/no questions with 100% precision independently. We will use picture cards to respond to yes/no questions, starting with cause and effect activities, and also offering 3 to 4 options such as piano, toys, foods to choose from, and moving on to action verbs. We will also incorporate questions of preferred activities of daily living in order to help establish preferences and state likes and dislikes. Example, do you want more yogurt? Goal number 2. Parents, caregivers will be familiar with programming the Big Mac with 100% accuracy. In order to comply with POC Medicaid regulations, these are all mandated participants. However, it is particularly important for parents to understand how the device works, as this will be the child's voice, and those in his everyday environment can facilitate and encourage communication through the consistent use of this AAC device. Goal number 3. Motivate and generalize the use of the device to multiple activities of daily living spontaneously. We will incorporate activities to elicit the understanding and expression of language. As the patient becomes more familiar with the device, we will expand vocabulary in tune with his environment. Throughout the therapy sessions, we will practice words and object identification to enable accurate comprehension and interpretation. And we will use simple familiar words which are in tune with personal experiences. Essentially, the main idea is functional communication. Goal number 4. Accurately and spontaneously use the Big Mac device for all activities of daily living according to needs and potential with 90% accuracy. Through the use of role play, we will practice communication skills in different contexts and activities. We will incorporate core vocabulary with the Big Mac using phrases such as I'm hungry, I'm sleepy, I want my piano. A few things to be mindful of are do not exceed the number of buttons necessary for optimal communication, as this may cause confusion and increase frustration. Remember to be patient. The responses are slow due to physical limitations. It takes time for the child to move his arms and hands to select the specific button to respond. And if in doubt with the answer, repeat and verify. Pay attention to face and body expressions. Also, distance the buttons on the board to minimize selecting the wrong one by mistake. And finally, use the device for everything. This will be his voice and a way to make himself understood.